We're here in the operating room today again, and we're doing a full female facial rejuvenation treatment. A lot of my patients, as they get older, they just don't want to do surgeries, and they kind of fight off the need to do surgery as long as they can, using a lot of the energy-based devices and lasers that I have, and some of the manipulative techniques that we have to literally lift, to tighten, and contour the face. So today we're doing a patient that's going to do internal heating on the neck and lower face called Face Tight. Melts fat, tightens the skin, and it'll give her an improvement in the contouring of her jawline and her neck. As we move up to the mid-face, we're going to use InstaLift threads. They build collagen over time. They're inserted very specifically in vectors to tighten the middle face. We're also going to do this on the lower face and neck in the near future to build more collagen in that area. So overall, we're going to do this big combination treatment of internal heating for the lower face and neck, threads for the middle face, plasma pen for the eyes, and full facial brightening and tightening with Morpheus and Clear and Brilliance. So we're putting in tumescent fluid in the neck. This is the first step to getting ready for Face Tight. So now we're just doing some little nerve blocks for the InstaLift. And the reason I'm doing this is not necessarily for pain because she's asleep, but it's more because there's medicine inside here that stops bruising. So first step is going to be to inject Sculptra. This is our collagen stimulator. You can see inside there's little particles. I call this our snow globe filler, even though it's not really a filler. It's going to contour her temple over time. We're going to do this twice in the year to lift this area. So now we're going to the deep medial fat pad. We're going to give a little dose there. We're going to go up along her fold now. This is right where the InstaLift is going to go. Now we're going to work on the pre-gel sulcus. We're going to go all the way down to bone. Already did piriform. We did lateral cheek. So we're going to the deep fat pads of the cheek. Just going to give a little bit there, and we're going to taper back along her lateral cheek. We're also going to again go to the pre-gel area for a little bit on the bone. And we're now putting in our threads. We mark these in pretty good detail to really focus on the vectors of her middle face. You can see already a little bit of dimpling right here. That's because she really needs tightening there. So right now we're just activating the cones. This pushes the cones onto the skin. You can see she has a little bit of dimpling there. That will go down in the next few weeks, but this will lead us to more tightening. This is not a face or a neck lift. You can see that thread is now under the skin. All of this puffiness is Sculptra and numbing, and you guys could see that here. Just make sure you pull it a little bit more. You can see the cones on here. This is an 8-cone thread. This thread is going to go under the skin. You can see here, and it's going to tighten this area. She's asleep right now because we're doing a bunch of procedures and some laser. Otherwise, this could be done in the office awake. So this is Face Tight, and honestly, if you get close, you should be able to hear popping. There it is. Hear it? So that's internal heating. This is the area that bothers her the most. Nice and slow. We can literally hear the popcorning. We're gonna overlap a little bit, get some degrees of tightening, and I can feel a lot of warmth under the skin here. And now we're doing just a little bit of lipo. This is micro lipo, very fine, just to contour the area using a power assisted device to shape out the neck. We're just trying to even it nice and smooth so that when it retracts back down, it's a little bit tighter and it's more even. So now we're doing Morpheus treatment for tightening. This is deep micro needles. You could see them puncturing the skin, and those go into the skin and they go underneath it and they tighten. We're going at different layers in the skin. This is our tightening portion of our Tighten Bright. So now we're doing the Clear and Brilliant. This is a very low level, low density laser. She has history of pigmentation and wants improvement. So we're working with the Premea, very low level. We did a peel right before, which cleared up a lot of her pigment. Literally, we just do these small bits. The key, the biggest key to getting a successful result with this is skincare. This is gonna tighten and brighten and less downtime than laser. Now we're just gonna put we're gonna put PRP and A-cell on her for all the lasers and everything we just did, and she's gonna heal.
Hey guys, Jonathan, esthetician. So we're currently doing the oxygen facial on our patient here, post-laser, along with some plasma pen, Morpheus, and some surgery. We're currently doing oxygen. Patient also did some threads as well. But yeah, I mean, oxygen's a great pick-me-up facial to kind of help the skin repair and regenerate. right after any kind of ablative treatment.
I think my skin is looking much more younger. I feel that I'm looking younger and smoother, and I hope to get an even better result than what I see right now. Right now it's a little swollen, so I can't figure out that much, but I know it will look better. It's already underneath the neck and everything, it's still looking awesome. It's amazing because I had a lot of laxity in my chin, in my jaw area, and so that looks tight. And my mid face is also looks lifted up. My area around my eyes were crinkly and like crepey. That looks much more smooth now, and the overall skin of the face and the neck looks much more youthful and lifted up.